So in this objective, we were really looking at what progress had been made in terms of developing nationally consistent peer support services for people with spinal cord injury. And there's some significant efforts that have been made in implementing these improvements over the period of the action plan. So New Zealand Spinal Trust and Spinal Support New Zealand are collaborating on developing a nationally consistent model. And at the moment, though, this hasn't included paediatric and adolescents with spinal cord injury. Spinal Support New Zealand have gone and employed 2 peer support staff. New Zealand Spinal Trust already had employed some staff, but this is without actually any additional funding from Ministry of Health or ACC to provide this, so it's charitable funding at this point. A scoping review of peer support literature has been completed, and this has been formed into a discussion paper which has gone to ACC around the need for funding for peer support. And there's been some ongoing research to evaluate how peer support works to support people with spinal cord injury, and how it could be improved to further optimise health outcomes for people. So generally people, well, 92% of people felt that peer support contributed to their inpatient experience. So that's those who answered the questions. However, there were a number of people that weren't aware of spinal peer support services. So within the surveys, 26% of adults and 43% of family members were not aware of the spinal peer support services. So we felt that that was something that could be improved. And there was also areas where people with higher levels of walking ability or those with an incomplete injury were more frequently talked about or mentioned in their survey responses that they were unaware of peer support or hadn't been offered it. So our recommendations were around ensuring that formalised regular support is offered to all people with spinal cord injury, regardless of their level of impairment, so whether they're complete or incomplete, and also to their family and whānau. And that includes implementing peer support services to children with newly acquired spinal cord injury in New Zealand. Obviously, there's a need for sustainable peer support services, and that's about the need for funding, really, to provide this service in recognition of the important role that they play within service delivery for people with spinal cord injury, making sure their needs are being met. And there's also a question about different roles that people with spinal cord injury could take in terms of supporting people maybe to navigate through services. Maybe this is a role, and it was kind of raised as an idea that maybe this navigational support, for instance, for those with Ministry of Health Ministry of Health funding could potentially be offered by peer support organisations. So it was just raised as a possibility to explore further. So that was the peer support one.